Femur, it is a long bone present in the thigh. It has got three parts, upper end, lower end, and shaft. Coming to the upper end of the femur, it has head. There is a depression in the head. Neck. Just behind the neck, there is a projection called greater trochanter. Posteriorly, there is a small projection called lesser trochanter. Head, neck, greater and lesser trochanter. These are the features in the upper part of femur. Now between the greater and lesser trochanter, anteriorly it is called intertrochanteric line. Posteriorly, between greater and lesser trochanter is intertrochanteric crest. Over that there is a projection called quadrate tubercle. The head of the femur articulates with the cup-shaped acetabulum of hip bone to form hip joint. So from the neck to the shaft, the angulation is about 125 degree. Coming to the greater trochanter, the parts of greater trochanter or apex. It has got four surfaces: anterior surface, lateral surface, posterior surface, medial surface. The medial surface has upper rough part and lower depressed areas called trochanteric fossa. It has the lesser trochanter has apex and base. Over the intertrochanteric crest, this tubercle is called quadrate tubercle. It receives quadratus femoris muscle attachment. Coming to the shaft, shaft has medial border, lateral border and posterior border. The posterior border is well defined. This posterior border is otherwise called linea aspera. What are the surfaces? Anterior surface, medial surface and lateral surface. This linea aspera above and below. This linea aspera above and below, it diverges so that the shaft has four surfaces in the upper and lower part of the shaft. We can see the two lips of linea aspera getting diverged. So there are anterior, posterior, medial and lateral surfaces in the upper and lower end. Lower part of the femur has got two projections called condyles. This prominence is called epicondyle, medial epicondyle and lateral epicondyle. Just below this lateral epicondyle, there is a groove. This groove lodges the tendon of popliteus muscle. Anteriorly, there is a line. This line gets attachment of capsule of knee joint. Posteriorly, the space between two condyles is called intercondylar notch or intercondylar fossa. So these are the features. Now coming to the attachments. In the head, there is a depression called fovea capitis. A ligament is attached to it called ligamentum teres or round ligament of femoris. Greater trochanter, what is attached to the apex? Piriformis muscle. In hip bone, this piriformis muscle takes attachment from the preauricular sulcus. Anterior part of greater trochanter gets gluteus minimus muscle. The gluteus minimus in hip bone is between inferior gluteal line and anterior gluteal line. Lateral surface of greater trochanter receives gluteus medius. It is between anterior and posterior gluteal line. Just below the greater trochanter, there is gluteal tuberosity which receives gluteus maximus. Here in the hip bone, it is behind posterior gluteal line. The muscle also takes attachment from dorsal 1/3 in the lateral slope of iliac crest. Here in the femur, it is in gluteal tuberosity. Medial surface of greater trochanter, the upper rough part receives Three muscles, tendon of obturator internus with two gemelli. In hip bone, from the obturator foramen, that is inner surface of obturator foramen, gives attachment to obturator internus muscle. The tendon of obturator internus passes through the lesser sciatic notch. Above and below we have two more muscles, superior and inferior gemelli. These three together are attached to the upper part of medial surface of greater trochanter. Tendon of obturator internus with two gemelli. Just below that there is a fossa called trochanteric fossa. Here, so this is obturator foramen. From the outer surface of obturator foramen we have obturator externus muscle. This obturator externus is inserted into the trochanteric fossa. To the lesser trochanter, to the apex, we have attachment of psoas major, which takes origin from transverse process of lumbar vertebra. To the base, we have iliacus. Here in the hip bone, iliacus takes attachment from iliac fossa. Just below the lesser trochanter, this surface gets attachment of pectineus. This pectineus in hip bone, it arises from pecten pubis, or the superior border of superior ramus of pubis. The superior border is otherwise called pecten pubis. It gives attachment to pectineus muscle or pectinate ligament of Cooper. Coming to the shaft of femur. So the shaft, the front of thigh has got four muscles, sartorius plus quadriceps femoris. Now coming to sartorius, it is attached to anterior superior iliac spine. In quadriceps femoris, coming to rectus femoris, straight head and reflected head are attached to anterior inferior iliac spine and just above the acetabulum. The rest of the muscle in the front of thigh are vastus intermedius, which takes attachment from anterior surface of femur, vastus medialis. So this is intertrochanteric line. From lower part of intertrochanteric line, it spirals backwards along the medial part of gluteal tuberosity, medial lip of linea aspera. This is the attachment of vastus medialis. Coming to vastus lateralis, it takes attachment from upper part of intertrochanteric line. It winds around the lower border of greater trochanter, gets attached to lateral part of gluteal tuberosity, lateral lip of linea aspera, lateral supracondylar ridge. So these are the three vasti muscle. Now to this linea aspera. The linea aspera has got two lips, medial lip and lateral lip. Here we can see in detail. This is medial lip of linea aspera. This is lateral lip of linea aspera. So medial side and lateral side. From the medial lip of linea aspera, medial intermuscular septum takes attachment. From the lateral lip of linea aspera, this medial intermuscular septum divides anterior compartment from medial compartment. So here we have lateral lip of linea aspera. Between medial and lateral, the posterior intermuscular septum takes attachment, which divides the medial compartment from posterior compartment. This lateral intermuscular septum separates posterior compartment from anterior compartment. Here to get orientation, so if this is the front of thigh, this medial intermuscular septum separates anterior compartment from the medial compartment. This side, lateral intermuscular septum separates anterior compartment from the posterior compartment. Behind this posterior intermuscular septum divides the medial compartment from the posterior compartment. So again, to get much more better clarification, if this is cross section of thigh, we have femur inside, and this posterior border is most prominent border, which is called linea aspera. There are two more borders, medial and lateral border. So from the medial border we have medial intermuscular septum, This side we have lateral intermuscular septum, posteriorly posterior intermuscular septum. So anterior compartment is called extensor compartment. Between medial and posterior intermuscular septum is medial compartment or adductor compartment. Between posterior and lateral intermuscular septum is posterior compartment. This posterior compartment contains group of muscles called hamstring muscles. So these are the three septa. Here we can orient medial intermuscular septum, lateral intermuscular septum, posterior intermuscular septum. Now between medial and posterior intermuscular septum is the medial compartment, that is adductor compartment. So the muscles in the adductor compartment are adductor longus, adductor brevis, adductor magnus. This adductor magnus descends down much lower to get attachment from adductor tubercle, which is just above the medial condyle of femur. Then we have posterior intermuscular septum. Between posterior and lateral septum is posterior compartment. We know all the group of muscles in hamstring takes attachment from ischial tuberosity. So the only left out muscle to take attachment from femur is short head of biceps femoris. It is the only muscle in the posterior compartment which takes attachment from femur. So between posterior and lateral intermuscular septum is short head of biceps femoris. Now from medial to lateral, so to the medial lip of linea aspera vastus medialis muscle, vastus medialis, adductor longus, adductor brevis, adductor magnus, posterior intermuscular septum, short head of biceps femoris, vastus lateralis. Again we can see these structures in bone from medial to lateral. Medial lip, that is vastus medialis, takes attachment. Then adductor longus, adductor brevis, adductor magnus. It descends down till the adductor tubercle just above the medial condyle of femur. From this adductor tubercle, the adductor magnus extends as tibial collateral ligament to get attachment to the medial part of tibia. So this adductor magnus, indirectly it is inserted to the tibia. Then next to adductor magnus, short head of biceps femoris and vastus lateralis. These are the two condyles. Between we have intercondylar notch. Above the medial condyle is medial head of gastrocnemius attachment. Above the lateral condyle is lateral head of gastrocnemius attachment and plantaris muscle. So this prominence is called epicondyle. Below the lateral epicondyle is popliteal groove for tendon of popliteus. Anterior surface gives attachment to vastus intermedius. Just below vastus intermedius there is a muscle called articularis genu. So this adductor tubercle above the medial condyle has medicolegal importance. It is formed by 9th week of intrauterine life, which denotes the viability of the fetus. So the death of the fetus before and after birth can be detected with the appearance of adductor tubercle. These are the attachments of femur. Thank you.